Hello, everyone. This is Manaz,
And I'm Sonam.
and we are both back again with another episode for seniors. This time, it's about the physical aspect of wellness.
आज मैं बहुत बहुत खुशी के साथ आप सबको बताती हूँ कि हमारे साथ हैं डॉक्टर दिलीप नाडकर्णी. डॉक्टर दिलीप नाडकर्णी is an orthopedic surgeon who specializes in treating sports and fitness related injuries. He has performed over 15,000 knee surgeries. He is affiliated to Leelavati Hospital. Dr. Nadkarni is also an author, a musician, a songwriter, a golfer, and a motivational speaker. Welcome to our show. Thank you so much, Dr. Nadkarni.
Thank you so much for inviting me, Minaz and Sonam. It's really a pleasure to spend an evening with lovely looking ladies.
Thank you.
So, Doctor, I'll start with the first question.
Yeah.
My question to you is, what are the age-related changes that happens in the bones, muscles, and joints, and how can we cope with them?
Okay. So aging is physiological. Nobody has escaped it. To some, it can happen early. To some privileged, lucky people, it happens late, but it happens to everybody. Now, the ladies, let's start with the ladies, are more prone to the bone becoming weak because of the natural progression of hormonal change. The bones start becoming weaker and they go from osteopenia to osteoporosis. Now, what is the meaning of these two terms? That the calcium and the matrix of the bone, which comprises of proteins, becomes deficient, the bones become brittle, and if there is an accident or a fall, then there is a higher chance of that bone breaking. Now, you see on television when there's a cricket match, these young cricketers, they are diving and getting the ball in their hands with great impact. The bones can take these things at that age and at that level of fitness. But here I get ladies who are in their 70s, where they just have a minor slip in the bathroom and they can't get up. And we then take an X-ray and see that there's a fracture of the hip. Now, these are the things which are related to weakness of the bones. It happens to men also, but the extent and the probability becomes much lower. You asked about the muscles. Now, the muscles are the living tissues in our body whom we can depute to do many things. We can use muscles to build bone, that is, strengthen the muscle, and the bone will also strengthen. We can stretch our muscles, and that's yoga. When we stretch our muscles, we get pleasure and we get flexibility and good health. So the muscles are very, very, very important to us. What happens as we age is two things. One, the muscles start becoming stiffer, and two, the muscles start becoming weaker.
Mm-hmm.
So the muscle is a very obedient organ. It's called a voluntary muscle because we can, by our own volition, we can ask the muscle to do so many things for us, like weight training, walking. When we employ these muscles gainfully, our whole health improves. The third thing are the joints. Now, the joints have suffered wear and tear of years of action, years of climbing stairs, descending stairs. They start becoming degenerated, which means the covering of the bones, which are the joints. What is the joint? The knee joint is where the tibia, the leg bone, and the femur, the thigh bone, they come together. And these bones are lined by what is called cartilage. As we age, the cartilage starts becoming thinner, thinner, and one day it disappears. And the bone starts meeting its bone on the other side, which is painful. And that is called osteoarthritis. So first I spoke about osteoporosis. Second was about muscles becoming weaker and stiffer. And third, the joint becoming into a degenerative osteoarthritis. Now, each of these need different methods of coping, which I think as we progress with your questions, we can, isolate them and talk about.
I want to ask you, doctor, is it safe to take supplements, and do they need to be taken under supervision? A lot of people will see some ad and start eating some supplement, and do we need to ensure breaks between supplementation?
Yeah. See, as the word says, supplementation, it is not replacement. Means I can't eat a protein powder every day and not eat the natural source of proteins which are available in our food. Or that goes for calcium and so many other things which are necessary for the human body. Now, supplements are needed if nutritionally the person is not eating correctly, or his system is not absorbing or metabolizing what is coming in the natural food which is given to us. Now, take for vitamin D. There's an epidemic of people who are having low vitamin D. Every patient I test when they come with backaches and knee pains, what happens is many of them are having deficiency of vitamin D. In these persons, under medical advice, I give vitamin D, and then as the course is on, we monitor it again to see that there's no overload or toxicity of the vitamin D. So your question stands absolutely fantastic, that it should be done under medical supervision. Some people douse themselves with calcium. Now, calcium is needed for the bones. If in many vegetarians, they feel that the calcium sources are not too, they are not rich enough. Right. And many people are vegans and they don't take milk products. So there is definitely a calcium intake deficiency. And I encourage these persons to take calcium. But that should not be on overdrive, where there is excessive calcium in the blood and that calcium is not correctly metabolized and it can cause problems. Now, supplements are there for osteoarthritis, wherein we give glucosamines and chondroitins. These are over-the-counter supplements. Now, over-the-counter has become, you just go to Google, you read one article, many of them are promotional articles, and then you end up buying so many supplements. So I think just as we take medical advice on exercise, we should also take correct amount and types of supplements which are needed for you. They should not become, you should not become a victim of marketing and douse yourself with the things which you don't need.
Absolutely.
So it's a waste of money, and it could be injurious in certain, like B12. Vegetarians are deficient in B12. And when we test it, we in not just supplements orally, I advise injections. So where it is needed, definitely needed, but I would go with the doctor's advice and don't fall to, whims, social media telling you take this, take that, and right. So under medical supervision, always. Supplements are superb. They are needed for when you need them, take them. Yeah.
Thank you, doctor. Another question for you is, what are the exercises which are safe for seniors?
Okay. Now, exercises are of many types. I classify exercises, and I've got a formula which reads SWAN. That is stretch, weight train, aerobic exercise, and the last is nutrition. Wow. So the safe exercises and effective exercises should always begin with stretching exercises. As I said earlier, that the muscles and joints start becoming stiff as we age. So suddenly at the age of 70, I don't want people to start doing acrobatics, which can give injury. So I encourage most of my people who come with early joint symptoms to start stretching their muscles. Now, stretching their muscle is again done with a trainer or a physiotherapist and under supervision. Once the person knows the form and the technique of stretching, then the person is free to do it as a home exercise program. One thing which is not heavily popular among the senior people is weight training or strength training exercises.
True.
Now, weight training, strength training is extremely important for prevention of osteoporosis. If I do a small weight related exercise, which means I pick up a pair of dumbbells, not heavy, and learn what is known as a dumbbell circuit workout, wherein most of the muscles can be strengthened with this dumbbell circuit weight training.
Okay.
Brilliant exercise, safe in most people. And once it is instituted and taught and supervised by a qualified person, it is superb. The muscles become strong, the bones become strong, and a host of musculoskeletal problems can be kept at bay with strengthening exercises or weight training exercises. The third is aerobic exercise. Now, aerobic exercise means that we do an activity where we burn calories in the right fashion. Now, most of the senior citizens, I tell them to go for a walk. Walking in fresh air is superb. Walking in sunshine gives us vitamin D synthesis. Get a pair of good shoes and start walking. The only contraindication is if your knees or hips have turned osteoarthritic, then I tell them to start cycling. Now, people say, cycling, doctor? Yes, cycling. It can be indoor cycling, wherein you don't have to balance, there are no accidents, and it is the safest and most effective method of burning calories without damaging the joints. So cycling is superb. Those who have access to swimming pools, swimming is actually hydrotherapy. So a person with osteoarthritis, painful knees, hips, back, they can get into the water and do simple swimming strokes which don't harm the body. The only downside of swimming is that it is not a weight-bearing exercise. So the osteoporosis, osteopenia element is better handled by walking rather than swimming. So the senior citizens can safely stretch their muscles, do strength training exercises, do aerobic exercise where we inhale fresh oxygen and burn our calories. And finally, it is nutrition, because if we do all this and eat badly, everything is neutralized. So I think the seniors can remember the SWAN formula, which I gave just now, SWAN, and exercise your way to happiness.
Lovely. Doctor, what are the top 3 tips you would give seniors to stay active and fit?
Okay. I think I also qualify to be a senior citizen. What is your definition of senior citizen?
So, anybody, I think, over the age of 60?
Yeah. So I am a fantastic example of what
Absolutely.
a senior citizen can do. So today is a Sunday, but I have done a surgery in the morning, then saw 1 or 2 emergency patients. Then I went and played 18 holes of golf.
Wow.
And I carried a 6-kilogram bag for 9 holes. And I've come home. I ate a nice dosa and played a little bit of harmonium. And now I'm talking to y'all.
Super.
And of course, then maybe I'll watch a movie with my wife. So remaining active is very important. And you must have a passion. You must learn new things. Now, what I've done is I've bought something called a melodica. It is a musical instrument wherein, you play like the harmonium, but you are breathing into it. Now, after the COVID epidemic, I said, why don't I just, get my lungs to exercise? So instead of singing, which I do, I said, just add this melodica. And of course, it's a great way of keeping everybody at home out of your way, because when you're playing that, they run away. So exercise is the most important tip for senior citizens. Second is music or meditation, which can calm your nerves. And the third thing is Sudoku, or some kind of a mental stimulation, like learning a musical instrument or trying to solve some problems, or I don't know, there may be so many other things I don't know about, wherein you are employing your brain to do things. Otherwise we can rust and go into Alzheimer's, or the brain, if you don't use it, you lose it. So a passion, whether it is mathematical or musical, or just reading new stuff, or trying to gain a new skill. Like my dad, he started learning singing when he retired at the age of 60. Lovely. He had a master ji who would come and he would do karaoke, and then and he started playing snooker at the age of 60. So these were two things. From his age, from 60 to 90, he had glorious years wherein, he was very passionate about these things, music and snooker and friends. So in golf, what do? I play the game, I have exercise, I'm trying to mentally challenge myself, physically challenge myself. And at the end of it, when you sit down and have a chai or a beer or a samosa is not a good word, or a chicken tikka, you are entertained by your friends.
True.
The bonding of either the family playing golf together or you're with friends is something which keeps the senior citizens young in their mind and heart. And I play with people who are in their 80s, who come to the golf course, they drive the buggy around, they hit the ball, they may play good or bad, but they go home very happy. So exercise, have a hobby, and mentally challenge yourself into newer skills. And that's what keeps the senior citizens as junior as possible in their faculties.
Lovely.
So the other question that I wanted to ask was, what are the causes of knee pain in senior citizens? You did mention one of them was osteoarthritis.
Yeah. So the knee is the most commonly degenerating joint in India among the senior citizens. If you come to Lilavati Hospital, half the operation theaters, there are surgeons who are replacing people's knee joints. Now, what has happened is that the longevity, good medical facilities, senior citizens trying new stuff, remaining young in their body and mind. But certain joints, they don't listen to you. And this happens to be the knee joint. So the pain in senior citizens could either come from a minor twist where a small cartilage is broken, but 95% of the knee pains are because of a degenerative condition. So I've in fact written a book which says how to avoid knee surgery. And all my orthopedic colleagues are daggers drawn, so chuhe kha ke billi, that comes back to me. So how to prevent a knee getting very bad? I have a formula. It's called the 3S formula, where you S for remain strong, 2 is remain supple, and 3 is you must be slim. So lower body weight is a boon which you can give to your knees. Apart from looking good, feeling good, the weight which is extra on our body directly goes and affects the knees. So the triple S formula, you be strong, you do your cycling, you do your gentle weight training like leg extension exercises, you do simple yoga poses where you stretch the muscles and ligaments around your knees, and you eat correctly. Eat correctly, and exercise your the aerobic system in which you lose your weight or maintain a low body weight, which can help you prevent knee problems, which can keep you away from the operation theater. So that is my take on knee pains in seniors.
Okay.
Yeah.
I also wanted to ask you, how can we keep our knees young and strong? Anything else other than the triple S formula?
Yeah, there are supplements also. Now, there are supplements which are given. It's not something which is foolproof and something which is absolutely 100% cartilage health is restored. It's but I've seen, and research says that these supplements like glucosamine, they help the knee cartilage better than if you were not taking them.
Oh,
And there are no side effects. So like people have fads कि मैं घी खाऊंगा तो my joints will become more
Lubricated.
lubricated. Now
Yeah.
these are myths, and there are countless myths. My whole thing is remain slim and remain flexible and do your strengthening exercises. Then there is genetics, heredity, the work life which you have had, like a person who has been like a teacher, standing all her life, you know, they get varicose veins, they get osteoarthritis. These are professional hazards. Like the person today's desk jockey, as I would call, work from home,
Right.
sitting on a desk for years.
Right.
They come out with back problems, neck problems, because the posture goes for a toss. You are so engrossed in your work, your eyes are getting spoiled.
Mhm.
So that's
All right. So, Doctor, before we end this interview, I would like to tell you that, as I said before we started, that I'm a fan of your singing, and I wonder if you would like to sing a few lines for our seniors who are
Yes,
watching
please.
this.
okay. आपके हसीन रुख पे आज नया नूर है, मेरा दिल मचल गया तो मेरा क्या कसूर है, आपके निगाह ने कहा तो कुछ जरूर है, मेरा दिल मचल गया तो मेरा क्या कसूर है.
Absolutely divine. Thank you.
Thank you so much. It was, the pleasure was entirely mine.
Thank you so much, Dr. Nadkarni, for your time and knowledge. I particularly will always remember the Swan and the 3S formula, and I'm going to make sure I'm going to learn the Melodica too. The information that you shared, the guidance that you have given will no doubt help each and every senior citizen who is watching this video. So thank you so much from me
Thank
and
you.
Sonam.
Thank you so, so much.
Thank you. Thank you.
And
And
cheers to wellness.
Cheers to wellness.
bye.